So it's the first time we've done this in this style, so in person with everyone in a room together. It has evolved from another event, which was the Nursing Times Digital Forum, which we've done for 2 years in a row, which is obviously an online event. The name goes with the title sort of thing. But we thought we needed to sort of move that on basically and get the entrepreneurs, the CNIOs and everyone else in the room together to have that networking opportunity and talk to each other really, which is what we've done today. And so far seems to have gone really well, lots of really valuable conversations going on, and yeah, been a great event. Yeah, I think it's been a really positive day. As I said, there are lots of valuable conversations going on, lots of engagement, lots of really good questions in all the sessions. Everyone's been really, really positive. Just really pleased to be in this space together, I think, and moving the agenda forward, and basically getting the nurse voice out there and raising awareness of what nurses can achieve in the digital space, and essentially, improving patient care, and helping the government with its analog to digital agenda. So we want to be there, nursing profession wants to be there, and hopefully after today we are. Also, I'm going to use the word resilience, but that's probably the wrong word, but the sheer desire and ability to not go away and just to keep pushing through with their idea until it's actually done. So Roxanne from Moorfields, who we've just been talking to now, great idea for an app for ophthalmic care. We gave her an award because we thought it was a brilliant idea, and it is, but the number of barriers that she had to get through to actually get her thing made and done, that is just one example, and I've heard it all day. It's just that sheer, they've got creativity, the dynamism, the great ideas to try and push forward really good clinical improvements. But the passion can only take you so far. You've got to have that just ability to get things done. Basically, just keep knocking on the door until someone realises that it's a good idea and basically helps you make it. Well, again, that's a tricky one. I suppose that nursing and healthcare in general is taught to be risk averse due to obvious reasons to do with patient safety, but equally you can't always move forward if you're risk averse. So in the last session that I just chaired just now, that whole topic was discussed, and again one of the speakers said, well look, if using the other side of being a clinician, which is evidence, if you take your evidence for what you want to do and what you've tried, if you've piloted it or something, and then take that with your idea to the CNIO or or whoever it might be, the fact you've got an evidence base immediately dilutes some of that risk, because it's no longer a risk, it's a proof of concept. It's research. So I think that's some way that people are looking to get around that kind of natural risk aversion that clinicians sometimes have. Nurses always need to be part of the strategy. You've got to take them with you. You've got to let them lead it. If you don't include them in the strategy, you've already lost, basically. Not just nurses, any clinician really. The same with patients. At the end of the day, you can't do that to the system. You need the system to go along with you. Events like this are obviously all about raising that awareness, increasing that voice, and making sure that the people that have the ability to make the stuff come to the people who know how to use the stuff and again end up using it, and basically let them lead with the development of the ideas, and then you will have basically again, it's a phrase I've heard used today so many times about partnership, team working, again, things that come across to nurses naturally and multidisciplinary. That's how, when you've got a clinical idea, you quite often have to involve other team members to make that happen. It's not just a nursing thing. It might be led by nurses. You need to include pharmacists or OTs or something like that. And it's the same with technology. It's just that you have to include different partners. You need your techie people, the people who do the geek speak, as has been said today. So it's about team working, but essentially you need to get the nurses, midwives, whoever it is, clinicians, with the ideas, give them the lead in what they want to do, because they know their patients, they know the system and how it can be improved. Well, hopefully the format of today has been a real mixture, so we've had real good keynote speakers. Sorry, I'll start that again. So think about the format from today, we've tried to really make a mix of presentations, case studies, panel sessions, and just general informal networking. So we started off with a brilliant keynote speech by the CNO for Wales, Sue Tranker. That really set the tone and got the energy in the room. And then we've gone into panel sessions with other really sort of high-profile people, movers and shakers in the digital nursing area. Again, heard what they've had to say and the advice that they've got, but equally, it's a forum for everyone. So I've heard some brilliant case studies with people who are nurse entrepreneurs who have really sort of gone through the process of getting their idea and then making it happen, and then just the informal networking opportunities with our sponsors, with our speakers, with our supporters. We've had some really good people in the room from all sorts of different levels of experience and background. So hopefully the sort of the mix of format that we've gone with, rather than just your traditional here's some people talking on a stage, hopefully doing it as a different versions of that in terms of presentations, case studies, panel sessions, informal networking, all creates a really powerful mix for an event. Hopefully everyone goes away in a really good place, inspired, and with some really good ideas to share, and hopefully improve care.